For many people, the whole idea of therapy seems confusing and impossibly expensive. The price often feels like a huge wall, and there's a lot of uncertainty about what you're even supposed to talk about once you get into the room. It's painted as a luxury that most people can't afford and don't really get. If you've ever felt that way, that you need help but have no idea where to start or how you could possibly pay for it, this video is for you. Hi, I'm BabyBatB, and I am a graduate with my master's in clinical mental health counseling, and I'm going to break down what it really happens in therapy to take away some of the mystery, and more importantly, I'm going to share the exact strategies that you can use to find professional help that won't drain your bank account, because mental health care shouldn't be a luxury. It's a necessity, and I promise it's more accessible than you think. So, let's start with the big question. What is therapy? At its core, therapy, also called psychotherapy, is just a process where you talk with a trained professional in a safe, private space. The whole point is to help you figure out and change the thoughts and feelings and behaviors that are holding you back. One of the biggest worries that people have is the first session. You might feel nervous, and that's totally normal. But the first session is really just a conversation, not an intense interrogation. It's a chance for you and the therapist to get to know each other and see if you're a good fit. Think of it like a two-way interview. You're checking them out as much as they're checking you out. Your therapist will probably ask you opening questions like what brought you in, what you're hoping to get out of it, and what's been going on in your life. But you are always in the driver's seat. You can go at a pace that feels comfortable. A good therapist will make you feel respected and understood, and they won't pressure you into talking about anything that you don't want to talk about, that you're not ready to talk about. It's also important to know that therapy isn't just one thing. There are many different kinds of therapy. One of the most common is cognitive behavioral therapy, CBT. CBT is based on the idea that our thoughts, feelings, and actions are all connected. It's very practical and focuses on present-day challenges, while it acknowledges that past experiences shape your way of thinking. It's all about giving you skills to deal with the here and the now. By learning to spot and challenge negative thought patterns, you can change how you feel and react. Another type you might hear about is dialectical behavior therapy, or DBT, which is similar to CBT but adds a huge emphasis on acceptance and mindfulness. It's especially good for handling intense emotions and relationship issues. Then there are approaches like psychodynamic therapy, which explores how your past shapes your present, and humanistic therapy, which is all about personal growth and becoming your best self. One of my favorites is Adlerian therapy, which, to break it down into its most simple form, it is mostly about the negative thoughts that you have in your head are coming from somebody else. Like, they are not your voice. It's another person's voice. Of course, you don't have to be an expert on any of these. It's the therapist's job to figure out what approach fits you best. The most important thing is the relationship you build with them, your therapeutic rapport. You need to feel safe, heard, and never judged. Sometimes after a session, you'll feel a huge sense of relief. Other times it might bring up some tough emotions, and that's okay. Okay, so now that we have a clear idea of what therapy is, let's tackle the biggest hurdle for most of us: the cost. For years, people have thought that without amazing insurance or a ton of extra cash, therapy was off the table. But that's not necessarily true. There are so many ways to get affordable care, and I'm going to share several of them, starting with some of the cheapest options. The first and most important term you need to know is sliding scale. A sliding scale is a flexible fee where therapists adjust their rates based on what a client can realistically afford. Many therapists in private practice set aside spots for clients who need a reduced fee. So how do you find them? Well, when you're searching on directories like Psychology Today's Therapist Finder, you can often filter for a therapist who offers a sliding scale. And don't be afraid to ask directly. When you call or email, it's totally okay to say, I'm really interested in working with you, but I have a limited budget. Do you offer a sliding scale? The worst they can say is no, but you'd be surprised how many are willing to work with you. Psychology Today's Therapist Finder is actually a really good tool. So if you go on the website for Psychology Today and go to their Therapist Finder, you can filter from insurance. If you have insurance, you can filter by if you want a male therapist, if you want a female therapist, what topics that they cover in their sessions, what different therapy styles, like if you've heard of a therapy style that you think would work very well with you, you can look and see if that's one of the ones that they're like a specialist in. So number 2 is one that not a lot of people know about. Did you know that most colleges with psychology or counseling graduate programs have community clinics? I actually went through a community clinic whenever I was in graduate school, and some of my first clients were from the community, from either in the college or the surrounding area. These clinics offer therapy to the public for a tiny fraction of the usual cost. Some of them do it for free. The sessions are with graduate students who are finishing their training, and they're always supervised by an experienced, licensed professional. This is a fantastic option for getting high quality care. I've seen clinics that charge as little as $5 to $20 a session, and like I said, some of them are free. To find one, just Google University Psychology Clinic near me or a low-cost counseling college in your city. It's one of the not intentionally kept secrets, but one of the secrets that like not a lot of people know about for affordable mental health care. The only drawback with this is that it will be short term with your therapist for a semester. So going into it, just keep in mind that while you may be a long-term patient or a long-term client, your therapist is going to change like per semester, and that can be a lot for a lot of people. That can be like opening up old wounds over and over again. And I know that's a big barrier for therapy, is the fear of like, what if my therapist just quits and then I have to open up to a new person? And what if this happens over and over and over again? But there are other options for people who are more long-term and less short-term. This next one is a game changer. There are non-profit organizations specifically created to connect people with affordable therapy. The best known one is Open Path Psychotherapy Collective. Open Path is a nonprofit network of therapists all over the country who have agreed to offer sessions at a much lower rate. And here's how it works. You pay a one-time lifetime membership fee of $65, and then after that you get access to their whole network of sessions that cost between $40 to $70 for individuals and up to $80 for couples. They even have options with student interns for a flat $30. To qualify, your annual household income generally needs to be under $100K. This organization is an incredible resource. Now, these are probably ones that you've heard of before. You've probably seen ads for online therapy platforms like BetterHelp and Talkspace. And while the full price can look steep, most of them have financial aid that makes them way more affordable. BetterHelp, for instance, is known for its financial aid program, which can offer a discount up to 40% off the standard month price. Their plans usually run from about $260 to $400 a month before that aid. Talkspace is another big one that is great if you have insurance. They partner with a lot of major insurance providers, and many people find their copay is pretty low. Their out-of-pocket plans can start around $69 a week. Nice. For just messaging therapy. Okay, so let's say you have insurance. If you have health insurance, your first move should be to figure out your mental health benefits. Call the number on your insurance card, or you can go to their website and look it up. Not a lot of people know that you can go to the website of your insurance provider, and you can look up your benefits on there if you would prefer not to talk to a human person, or in this day and age, an AI chatbot. Call the number on your insurance card if you can, and ask about in-network mental health benefits and your copay. It can sometimes be a hassle, but it's worth it. And here is a resource that people always forget about: employee assistance programs, or EAPs. Many companies do offer EAPs that give you a set number of free counseling sessions, usually between 3 and 10. This is completely confidential. Your employer will never know that you used it, and it's a free benefit. So if you have it, please use it. Another powerful and much more affordable option is group therapy. In group therapy, a small group of people dealing with similar issues meet with a therapist, and they talk about their shared problem, like anxiety, grief, depression, together with a therapist. Not only are the sessions way cheaper than individual therapy, but there's a unique benefit. Hearing from others that are going through the same thing as you can make you feel so much less alone. It builds a powerful sense of community and reminds you that you're not the only one going through this. Finally, my final resource is community mental health. Look into your local community mental health centers. These are centers often funded by the state or the county that provide affordable mental health care to residents. They almost always use a sliding scale based on your income and are a critical resource for low-cost care. You can find them by searching for Community Mental Health Center in your county. The Substance Abuse and Mental Health Services Administration, or SAMHSA, also has a national helpline and online treatment locator that can help you find low-cost care in your area. So, as you can see, there are many different ways to get affordable mental health care, whether it's finding a therapist with a sliding scale, using a service like OpenPath, or checking out a university clinic. You do have options. The standard cost of therapy, which can be high, isn't the only price out there. It may take a little bit of research, but please don't let the cost be the reason that you don't get the support that you deserve. Taking that first step is the hardest part, but you can absolutely do it. If this was helpful for you, please consider subscribing for more videos on navigating your mental health journey. Like I said, my name is BabyBatB. I am a VTuber and also a clinical mental health counselor. I specifically work in addictions counseling. Every single resource I mentioned will be linked in the description box below, so please be sure to check that out. And finally, if you know of any other awesome, affordable mental health care resources that I missed, please share them for everybody else in the comments. Your suggestions might just be the one thing that helps somebody else finally take that step. Thanks so much for watching, and be well. Bye-bye.